It's so interesting. Not only is the album itself, pretty monumental in the themes that she talks about, as far as Taylor Swift's new album, but also just the responses on Twitter from Taylor Swift's new album have been amazing. And I've definitely been following that as well. So, she talks about having an eating disorder, struggles with weight, and even particular lines in her album have been taken out by fans and retweeted. And she also talks about depression. And so I know there's a line where she sort of likens her depression to being on a graveyard shift. And that really resonated with a lot of people, and thinking about, how depression can be tied to insomnia and sleepless nights and sort of messing with your sleep-wake cycle, which is very much a thing with depression. I feel like not only was the album itself very monumental when it comes to talking about mental health issues and topics in an artful and creative way, but also I've been very pleased to just see how much it resonated with fans and how much they really are listening to the lyrics and the symbolism behind those lyrics. And people have even retweeted like, this very much resonated with me and my depression or my eating disorder, or I see myself in this album. I was listening to this and crying at night. So it very much resonated with fans. And I think that's really, really important. Another celebrity that I want to highlight that I have been a big fan of has been Lizzo. And Lizzo, who's currently on tour, has done so much for body positivity and talking about anti-Black racism and transphobia and just so much. I mean, her tour, which I went to see, was literally like therapy. I mean, I felt like I was like in therapy in her tour. She was talking about how special everyone is and like love yourself and self-worth. And so celebrities are doing a lot of amazing things. And so I'm really excited to see what they continue to do and think about ways in which psychiatrists can continue to partner with them. Megan Thee Stallion has a whole online platform now. And one of the things that I really like about her website is that there's actually on the website, you can actually search for diverse therapists, meaning, specifically, Black people, Black patients. It's a real problem for minoritized patients to not be able to find therapists of their background, and not just, Black people, but other people of color, LGBTQ, people of essentially, minoritized and marginalized backgrounds are often seeking therapists that have that background or have an expertise in working with people of their background. And so what I really like about Megan Thee Stallion's platform is it's around, empowering women that you can be a strong woman and an amazing woman and still seek therapy. And that it's okay as a woman, especially as a Black woman, where, personally as a Black woman, I make up less than 2% of psychiatrists. So there is a real need for more Black therapists. And oftentimes Black patients are seeking a Black therapist, but they don't know how to find us. So I love that she has so many resources to seek therapy. There's a lot of focus on sort of the negative, the negative impact of sort of talking about mental health in the media and even among celebrities of like, oh, you're spreading disinformation. And like, what if, you're sort of inappropriately representing mental illness and just, all these, things that, are very real issues in the media and things that we have to consider. Like, are we actually spreading good information? But we were like, but there's actually a lot of really positive things about what celebrities are doing with their platforms. And we have, in the paper, we talk about how, multiple celebrities disclosing mental illness. So like in the paper, we talked about Demi Lovato and, people like that, where after they sort of disclosed that they had a mental illness, you actually saw like not only an increase in help-seeking behaviors, but sort of a decrease in sort of how the general public viewed people with mental illnesses. And so I think that's really, really important. I think there's also a lot of benefit in using these celebrities as a model and connecting with our patients. And so, when talking about mental illnesses with kids or with adolescents, especially, likening it to celebrities that are out there and platforms that are out there, and sort of, basically using, all the positives from celebrities, and all the kids and adolescents and adults who look up to those celebrities, and basically saying like, hey, here's an example of someone who's endorsing that they have a mental illness, or they have a platform, that's destigmatizing mental illness. Have you seen it? What do you think about it? So it can be a really great way to engage with patients as well. And so I think, there's a lot to learn, and there's a lot to be done with celebrities as far as partnering. And I think sometimes, psychiatry can be a siloed field. We can be like very much sort of in our bubble of like psychiatry. And so it can be this like mystical thing, and like no one knows what's happening. It's like, what is psychiatry and what are we doing? And so I think also by partnering with celebrities, we sort of, we can share, accurate information in a way that's able to be like widely disseminated. And also like share like, hey, we have normal conversations. Like, psychiatrists and our psychiatric patients are regular people. Like, we have fun. We talk about things. Like, it's not this scary, like mystical thing. And so I think there's so much work that we still have to do, but I have been pretty optimistic about the newer generations, upcoming generations. And I do think there's seems to be a lot more talk about mental health in a positive and accurate light that I very much co-sign.